Good to be with you again.
Thank you, sir.
So this is like what, the fourth session of this implant presentation?
Yeah.
And the first one was more didactic and CBCT and learning how to do case presentations. Now you do that still in these other three patient treatment sessions, but you're placing implants now.
Yeah.
And before these courses, you'd placed a couple.
Yeah.
How has this course helped you?
Oh man, it's been phenomenal. Like the transformation of my confidence to go into a case where I'm, meeting a patient for the first time. I'm seeing that there's an opportunity for an implant, but now I know how to work up that case from the beginning, right? Whereas before, I knew that the patient needed an implant, but I didn't know the steps I was going to take to get that implant in there. I didn't know what to look out for in terms of bone width or anatomy, right? I had a cone beam, but I really didn't know how to interpret it. So now what this course helped me do was kind of put everything together in a systematized, systematized order to where now I can follow steps 1 through, however many, and get an implant in there.
And in these 3 patient treatment sessions, each of them 2 days each,
Yeah.
about how many implants total when you get done will you have placed with these 3 sessions?
Yeah, so altogether it's probably gonna be close to 15, about 15 implants altogether.
And you had the CBCTs ahead of time?
Yeah, I think that's the most useful portion of this is that I'm receiving the CBCT, about 2 weeks before I come to the course. I'm able to learn about my patient's medical history as well. I'm able to plan their case. I'm able to present that here in front of Dr. Hillam and all the other doctors, including yourself. We're able to talk about it, kind of see if we're thinking around the same, lines, and then I get to see that actual patient here in the course and place the actual implant that I had spent about 2 weeks planning for.
With personal instruction, a mentor by your side to help answer your questions and help you do the case.
Exactly.
So how's the pressure doing this case presentation in front of a group? I mean,
So
do you mind that?
Yeah, no. So like all of us, right? There's always a little bit of anxiousness of going up and speaking in front of a group, but it's a real cozy setting, right? There's about 6 doctors in these courses lately, and we're all here to learn, right? So it's not about making a presentation that's going to blow anyone away. We've got guidelines on the several points that they want us to talk about, and it's nothing like. It's nothing that we're going in front of this big, auditorium.
No pressure.
No, it's a very nice, cozy environment that's a learning environment, right? There's no judgment going on.
It helps you get confidence to do more implants.
Yeah, absolutely. And that's how I learn best, is by talking out loud with things and hearing other people's point of view. And then we get to ask each other questions, and we're learning together as a group.
Yeah. That's awesome. Thanks so much for talking with me about
Absolutely,
this.
Dr. Koerner.
Okay.
Yeah.